Hello everyone, in our anatomy on Blackboard series, today we are going to discuss regarding the rectum, which is the distal part of the large intestine. Here it exists, and above it continues from the sigmoid colon, and below it extends as anal canal. And there exist some exceptions in case of rectum. We all know that the large intestine have few special features. One were hastration, the second one is appendicesepiploicae, which is small bag of peritoneum containing fat, and then ini-cet. So, in case of rectum, all these three specifications of large intestine were absent. So now, let us discuss regarding the situation of rectum. Rectum is situated in the lesser pelvis and mainly in the posterior part. So, this forms the pelvic brim and this lesser pelvis exists below the pelvic brim, and here is the exact location where the rectum is situated, and above the pelvic brim forms the greater pelvis. So, pelvic brim is the exact demarcation between the greater pelvis and lesser pelvis, and in lesser pelvis and mainly in the posterior part, our rectum is situated. Our rectum begins mainly in the S3 level. So, now let us talk regarding the dimensions of rectum. So, length of the rectum is 12 centimeter and diameter of the rectum were 4 centimeter in the beginning. So, in the beginning it is 4 centimeter, and on continuation it becomes dilated at the end and forms the rectal ampulla, the dilated part in the distal end of the rectum, which is called as rectal ampulla, and here it begins at 4 centimeter and extend downward. So now regarding the course and direction of rectum. So this is the abdominal wall, and this is where the sacrum and coccyx located. So first, rectum begins here in the S3 level, and it is situated in the posterior part of the lesser pelvis, as I had already told. And now the rectum extends downwards and backwards like this, and then again downwards, and then downward and forward. And this is the exact course of the rectum that we should know. So first is downward and backward, then downward, then again downward and forward. So in case of rectum, we have two different types of curvatures. One is antero-posterior, and another one is lateral curvature. And in case of antero-posterior, we have two different. One is sacral flexure and another one is perineal flexure. In case of lateral curvatures, we have three different. One is upper, another one middle, and the last one is lower. So let's see first regarding the antero-posterior curvatures. This forms the sacral flexure, and this curvature forms the perineal flexure. And adding to this point, I would like to say another more interesting thing which we had already seen, that we had noticed one terminology, that is rectal ampulla, and this is a part which is also called as rectal ampulla, the dilated end of the rectum. So this is all about the antero-posterior curvatures. So now regarding the lateral curvatures, this upper curvature is convex and towards the right side. Then comes the middle curvature, which is very prominent and convex towards left side, and this is the middle curvature. And now this is the lower curvature, which is convex towards right. So this is all about the lateral curvatures of rectum. So in case of rectum, we are having two different types of curvature. One is antero-posterior and another one is lateral. And in case of antero-posterior, we are having sacral and perineal flexure. So sacral flexure is here and perineal flexure is here. And this area of perineal flexure is having the dilated end of the rectum, which already we had seen, that is rectal ampullae. And regarding the lateral curvature, there are three different lateral curvature. One is upper, middle and lower. So in case of upper curvature, it is convex and it is towards the right side. And in case of middle curvature, this forms the prominent portion and it is convex towards the left. And in case of lower curvature, it is convex to the right side. You can see in the image. So now let us discuss regarding the peritoneal relations of rectum. So here we are dividing rectum into three parts, that is upper 1/3, middle 1/3 and lower 1/3. So in case of upper one third, we are having peritoneum in the front and sides like this. Upper part is having the peritoneum both in front and sides. And in case of middle one third, we are having peritoneum mainly in the front. And in case of lower one third, which is other than rectal ampulla, this is the part. Here there is no peritoneum in the lower one third. So in case of males, there will be a rectovesical pouch. So you just imagine. So in case of males, we will be having a rectovesical pouch, which is formed by the peritoneum. And in case of female, there will be a rectouterine pouch that I will show you now. So as I mentioned, here there will be urinary bladder in case of male. So here our peritoneum extends like this. And this is the rectovesical pouch in case of male. So in case of female, we will be having uterus here. So this uterine portion is separated from the rectum with the help of a peritoneal pouch that is called as a rectouterine pouch in case of female. So now let us discuss regarding the visceral relations of rectum. So here we will be discussing it as anterior and posterior relation. So in case of anterior, we will be discussing separately for female and male, and in case of posterior, it is same for both. So now let us start with the anterior relation of rectum in male. Regarding the anterior relationship of rectum in case of males, so here you can see the S3 level where the rectum is originating, and this is the coccyx, and here is the anal canal, and this green is indicating the anococcygeal ligament, and this is perineal body, and this one is perineal membrane. So in front of rectum, we can see this peritoneal membrane, that is rectovesical pouch, which we had already seen, and this is urinary bladder, and this is prostate gland. So now let's go in detail regarding the exact relations. So here we can see rectovesical pouch, and here exists the coils of intestine. Coils of intestine would be existing here, like small intestine, and above the rectum we are having sigmoid colon. Okay, then in the lower one third, it is urinary bladder, then the prostate gland, and here exist seminal vesicles, ductus deferens, and ureter. So if we are checking out the anterior relationship of rectum in case of male, we will be dividing the rectum into two halves. One is upper one third and the lower half. So upper half is related to the rectovesical pouch first, and the coils of intestine and the sigmoid colon. And in case of lower half, we can see urinary bladder, prostate here, prostate, seminal vesicles, ductus deferens, and the ureter. So in case of anterior visceral relations in female, first the rectum is divided into upper two third and the lower one third. So in case of upper two third, you can see the peritoneal reflection, that is rectouterine pouch with coils of intestine. It would be present over here, coils of intestine. And then here comes the sigmoid colon. And then in case of lower one third, we can see the vaginal portion in front of the rectum. And this green one is indicating the cervical arch. And this is our urinary bladder. And this is the urethra. So I'm just repeating again, in case of anterior relationship, we are having the rectouterine pouch and coils of intestine along with sigmoid colon. And in case of lower one third of the rectum, we are having vagina. So now we are moving towards the posterior relations of rectum, which is similar in case of both male and female. So first, in case of posterior relation, as we had seen already, there will be S3, S4, S5, then coccyx, then anococcygeal ligament. Then comes the muscles which are related. First is piriformis. Here we can see the piriformis muscle. Then comes our coccygeus. Then at last, here comes the levator ani. Then comes our median sacral artery here. And then lateral sacral artery here. And then comes the sympathetic and parasympathetic nerve plexus. So in case of sympathetic chain, it is S3, S4, S5. And in case of parasympathetic, it is pelvic splanchnic nerve, both the sympathetic and parasympathetic. And related to it, we will be having lymphatics and fat. So let's see once again regarding the posterior relationship. So already we know regarding the sacral promontory, that is S3, S4, S5. So now let's see regarding the posterior relations of rectum again. So directly it is related to the S3, S4 and S5 sacrum, and then coccyx, then the anococcygeal ligament. Then in case of muscle, it is piriformis, then coccygeus, and the levator ani. And then comes the artery, which is related, that is median sacral artery, then lateral sacral artery, and then sympathetic and parasympathetic chain, and some lymphatics and fat present over there. Now let's see regarding the mucosal folds. In case of mucosal folds, we are having two different. One is longitudinal and another one is transverse. So this longitudinal one is temporary or transitory. So this longitudinal one is transitory. So once the rectum get distended, this will obliterate. And now regarding the transverse, it is also called as Houston valve or plicae transversalis. So till now in case of large intestine, we had seen regarding the plicae semilunaris, but now here we are talking regarding transversalis. So this is one of the important MCQ that the special feature of mucosal folds of rectum were called as Houston valve or plicae transversalis. And here these transverse folds were permanent and it exists even if the rectum gets distended. So this is all regarding the mucosal folds of rectum. Now regarding the functional parts of rectum. So here we have to divide rectum into two. One is upper part and the one is lower part. Here it is divided into two by middle fold of rectum. Middle fold. So this upper part is originated from hindgut and the lower part of rectum gets originated from cloaca. So this is all regarding the functional parts of rectum. And this rectum always remains empty in case of normal individual and it is very sensitive to distension. Once the feces reach into the rectum, it causes the desire to defecate. So now let us discuss regarding the arterial supply. So we all know abdominal aorta dividing into common iliac artery, and the common iliac artery divides into external iliac and internal iliac. So now in case of rectum, the major arterial supply is through the superior rectal vein, and this superior rectal vein originates from the inferior mesenteric artery here, and it reaches here the rectum. So the first artery is superior rectal artery, which is arising from inferior mesenteric artery, which is the branch of abdominal aorta. So this one abdominal aorta, and this one is inferior mesenteric artery, and here comes our first arterial supply and major arterial supply of rectum, that is superior rectal artery. The second major arterial supply, that is middle rectal artery. So middle rectal artery arises mainly from the internal iliac artery. So here comes our second major supply. So this middle rectal artery arises from internal iliac. Here I had told this is abdominal aorta, and this abdominal aorta divides into common iliac, and common iliac divides into internal iliac artery and external iliac artery. And this internal iliac artery gives arising to the middle rectal artery. Then comes our third major arterial supply of rectum, that is median sacral artery. In posterior relation we had seen, and it arises from the, and it is a small division arising from the back of aorta, supplying directly the rectum. So this is all regarding the arterial supply of rectum. So first one is superior rectal artery arising from the inferior mesenteric artery here, and it is draining here. And second one is middle rectal artery, which is arising from the internal iliac artery, and third one is median sacral artery arising directly from the back of abdominal aorta. So now regarding the venous drainage. And here comes the major venous drainage, that is superior rectal vein. It arises from the internal venous plexus present over here. Internal venous plexus. And it gets joined to form the superior rectal vein. And this superior rectal vein drains into inferior mesenteric vein. And this inferior mesenteric vein drains into splenic vein. Then comes middle rectal vein, which arises from this internal venous plexus and drains directly into internal iliac vein here. This is the middle rectal vein, drains into internal iliac vein. The same appears in here. So here MRV, that is middle rectal vein arising and directly draining into internal iliac vein. Then comes the third venous drainage, that is median sacral veins, which drains directly into left common iliac vein. So this is all regarding the venous supply. Here we are having three major venous drainage. One is superior rectal vein, which is arising from the internal venous plexus, and the superior rectal vein drains into inferior mesenteric vein, that drains into the splenic vein. And then comes the second major venous drainage, that is middle rectal vein, which is draining directly into the internal iliac vein. And at last it is median sacral vein, which is draining directly into the left common iliac vein. Regarding the lymphatic drainage, here rectum is divided into two parts, upper half and lower half. Here this upper lymphatics drains into pararectal and sigmoid nodes, sigmoid lymph nodes, which drains into inferior mesenteric nodes. And then this lower half, which drains into internal iliac nodes. So you have to remember this specifically because upper half and lower half are having different lymphatic drainage. So here these lymph nodes were present along the superior rectal vessels. And in case of lower half, the lymphatics were present along the middle rectal vessels. So this is all regarding the lymphatic drainage. The upper half and lower half, upper half is draining into pararectal and sigmoid lymph nodes, which is draining into the inferior mesenteric nodes, and in case of lower half, it is draining directly into the internal iliac nodes. So now regarding the nerve supply of rectum. So in case of sympathetic supply, it arises from L1 and L2, and parasympathetic supply, it is through S2, S3 and S4, and all this nerve supply occurs mainly through the superior rectal or inferior mesenteric and inferior hypogastric nerve plexus. So we will make one exclusive video regarding the enteric nervous system, that will be very useful. So regarding the sympathetic activity, it is vasoconstrictor, and in case of parasympathetic activity, it is vasodilator. Sympathetic activity, it inhibits the rectal musculature and it provides motor action to the internal sphincter. And here parasympathetic activity inhibits the internal sphincter. So in that video we will be discussing in detail regarding the exact action of both the sympathetic and parasympathetic nervous system. And here parasympathetic activity will be carrying out the sensations of distension. And here pain sensation is carried both by sympathetic and parasympathetic nerve plexus. This is all regarding the nervous system. So here in case of sympathetic, we will be having vasoconstrictor action, and parasympathetic. So in case of sympathetic, we will be having vasoconstrictor action. In case of parasympathetic, we will be having vasodilator action. And in case of sympathetic, we will be having inhibition to the rectal muscle with motor to the internal sphincter. And in case of parasympathetic, we will be having inhibition for the internal sphincter, and there will be a sensation of distension. And pain sensation will be carried both by the sympathetic and parasympathetic nerve plexus. So now let us discuss regarding the supports of rectum. So regarding the first support of rectum, that is pelvic floor. First is pelvic floor, which is formed by levator and a muscle. And here comes the perineal body, and here comes the perineal membrane, which mainly forms the pelvic floor support for the rectum. Then comes fascia of Waldeyer. This fascia of Waldeyer present in the lower part of the rectal ampulla and connects the sacrum. So this is the fascia of Waldeyer. Fascia. So this forms the fascia of Waldeyer, and this is nothing but the condensation of pelvic fascia behind the rectum, and here it encloses the superior rectal vessels and its lymphatics. And then regarding the lateral ligaments of the rectum, so we all know this forms the pelvic brim. So below the pelvic brim is the true pelvis where our rectum is located. So you just imagine this is our rectum on cross section, sorry, on transverse section. So here comes the lateral ligament of rectum, which attaches the rectum to the lateral wall and posterior wall of the pelvis. Okay, so this is none other than the third one, lateral ligament of rectum, which attaches the rectum to the posterior and the lateral walls of the pelvis. And here in this, this is also a condensation of pelvic fascia, and this ligament encloses the middle rectal vessels and their lymphatics. So next comes the fourth support, that is fascia of Denon-Villiers. So this is also called as rectovesical fascia. So it is present here because it separates the rectum from urinary bladder. Here comes the rectovesical pouch, and here we are having the fascia of Denon-Villiers. So fascia of Denon-Villiers is in the anterior side of the rectum, and fascia of Waldeyer present in the posterior side of the rectum. You can remember that fascia of Waldeyer is nearby to the sacral wall. And there comes the other few supports of rectum, that is pelvic peritoneum along with the blood vessels. Then perineal body and its membrane, which I had already mentioned, perineal body present here, which forms the major support. And this is all regarding the rectum. So now let us have a quick recap of rectum. Rectum from the distal part of the large intestine, which is present over here, and above it is connected with the sigmoid colon, and below it continues as anal canal. And we all know that this hastrations, appendicesepiploicae and tinea coli forms the major special features of large intestine, but these three things are absent in case of rectum. That is the major exception. So now regarding the situation, it is situated in the posterior part of the lesser pelvis. So how this lesser pelvis is formed? So this red line is indicating the pelvic brim. So the portion below the pelvic brim is called true pelvis or lesser pelvis, and above the pelvic brim is called greater pelvis or false pelvis. And rectum is situated in the posterior part of the sacrum, and it begins at the S3 level, and length of the rectum is 12 centimeter and diameter is 4 centimeter. And on beginning it will be having 4 centimeter, and at the end it will dilate to form the rectal ampulla. So now regarding the course and direction of rectum. So here already we had seen that rectum extends downwards and backwards, then it extends again downwards, then it extends again downward and forward. So here in case of rectum we are having two different curvatures, that is anteroposterior curvature and lateral curvature. And anteroposterior curvature we are having the sacral flexure and the perineal flexure, and this perineal flexure forms the rectal ampulla, which is the dilated part of the rectum. And this lateral curvatures we are having three, one is upper, middle and lower, and this upper is convex and it is towards the right, and middle one is the prominent one and it moves and it is convex and towards the left, and this lower part is convex and it moves towards the right. So now regarding the peritoneal relations of rectum, upper one third is covered by peritoneum in front and sides, and in case of middle it is on the front only, and in case of lower one third we will be having rectal ampulla and there will be no peritoneum. And here we are having two peritoneal pouch, that is in case of male it is rectovesical pouch which separates the rectum and bladder, and in case of female it is rectouterine pouch which separates the rectum and uterus. So in case of visceral relation, we will be seeing anterior and posterior, and in case of anterior, it is different for both male and female, and in posterior, it is same for both male and female. So let's see regarding the anterior relationship in male. So here the rectum is divided into upper two third and lower one third. Upper two third is related in anteriorly with the rectovesical pouch, and then with the coils of intestine, and third with the sigmoid colon. And in case of lower one third, we will be having urinary bladder, then prostate, then we will be having seminal vesicles, then ductus deferens and ureter. And this is the anococcygeal ligament, and here comes the sacrum, coccyx, and perineal body. And in case of female, we will be having a recto-uterine pouch, which separates it from the coils of intestine, and above we will be having the sigmoid colon. And in case of lower one-third, we will be having the vaginal portion, and here is the urinary bladder and urethra, which is not connected with the rectum, and this is the cervical arch. So now regarding the posterior relation, we can see it extends from S3 to S5, then coccyx, then anococcygeal ligament. Then if we are discussing regarding the muscles, piriformis is there, then coccygeus is there, then levator ani. And in case of artery which is related posteriorly, one is median sacral artery and another one is lateral sacral artery. And then comes the nervous system, both the sympathetic and parasympathetic, and other few lymphatics and the fat. This forms the posterior relations of rectum. And now regarding the mucosal folds, in case of mucosal folds, we are having longitudinal one and transverse one. This longitudinal one is always transitory, so whenever there is any distension, this will get obliterate. And in case of transverse, it is also called as Houston valve or valve of Houston, and it is also called as plicae transversalis. And this is one of the important MCQ point you have to remember in case of rectum. And these things are permanent, so whenever there is obliteration, like whenever there is distension or dilatation of the rectum, there will be no obliteration of this transverse mucosal folds. Now regarding the functional parts of rectum, the rectum is divided into two by the middle fold of rectum, and upper half is made of hindgut and the lower half is made of cloaca. So before getting in detail with the arterial supply, let me explain regarding the abdominal aorta. So this is the abdominal aorta, we all know, and this abdominal aorta divides into two as common iliac artery, and this common iliac artery bifurcates into external iliac and internal iliac. This is regarding the major bifurcation of abdominal aorta. And here the major blood supply for rectum is through superior rectal artery, which is arising from the inferior mesenteric artery, and this inferior mesenteric artery is arising from the abdominal aorta here. And then comes the middle rectal artery, which is arising from the internal iliac artery. Then comes the third arterial supply, that is median sacral artery, which is arising from the back of the abdominal aorta here. So as you had seen in the arterial supply, here also same venous drainage. First one is superior rectal vein, then middle rectal vein, and the third one is median sacral vein. So this superior rectal vein arises from the internal venous plexus, and this superior rectal vein drains into the inferior mesenteric vein, and this inferior mesenteric vein drains into the splenic vein. Then the second vein, that is middle rectal vein, which arises from the internal plexus, and it drains into the internal iliac vein. And then comes the third venous plexus, that is median sacral vein, which drains directly into the left common iliac vein. So now regarding the lymphatic drainage, the upper part drains into the pararectal and sigmoid lymph node, which drains into the inferior mesenteric nodes, and these nodes were present along the superior rectal vessels. And here the lower part drains into the internal iliac nodes, and here these lymph nodes present along the middle rectal vessels. So now regarding the nerve supply, sympathetic chain is through L1 and L2, and parasympathetic is through S2, S3 and S4, that is pelvic splanchnic nerve, and this is mainly through the superior rectal, inferior mesenteric and inferior hypogastric plexus of nerves. And this sympathetic activity is vasoconstriction and inhibition of the rectal muscle and motor to the internal sphincter, and parasympathetic activity is vasodilatation. It inhibits the internal sphincter and it has the sensation for distension, paresy, and the pain sensation is carried by both the sympathetic and parasympathetic nerve plexus. So now regarding the supports of rectum. So first, major support is through the pelvic floor, which is formed by the levator ani, and here the perineal body is existing, which forms the one of the major support. Then comes the fascia of Waldeyer, which connects the rectum with the posterior wall, that is sacrum. So here it has the superior rectal vessels, and then next comes the third one, that is lateral ligaments of rectum. So this lateral ligaments of rectum connects the rectum to the posterior and the lateral wall of the pelvis, and here this ligament will be carrying out the middle rectal vessels. And then comes the fourth major support, that is fascia of Denon-Villers or rectovesical fascia. So it is present in the anterior part of the rectum, and here it connects the urinary bladder and the rectum. So major support here. And finally pelvic peritoneum and the blood vessels associated with it.
So here we had completed the anatomy of rectum. So if you have any suggestions regarding the topic of discussion, kindly comment below. And thank you so much. Happy learning.